Hello, this is Elsa Zuna-Richards with M3 Planning, and today I'm going to be talking to you about the Balanced Scorecard principles and how it applies to accreditation. So welcome to those public health departments that are joining us today. So what is the purpose of the Balanced Scorecard? And that's what we're going to be talking today and how it applies to your accreditation process. So my agenda today is going to be going over what is the Balanced Scorecard system, and then what is its purpose in an organization. How does the Balanced Scorecard framework contribute to the Public Health Department Accreditation process, and how do we align the FAB domains to the Balanced Scorecard, and then just keeping our goals SMART. So let's go on. What is the Balanced Scorecard? The Balanced Scorecard is a strategic planning and management tool used in business and industry, government, the public sector, such as your public health departments, and nonprofit organizations. So what does it do and what purpose does it serve in an organization? It aligns an organization behind a shared vision. So what it does is it keeps the team working on the right things and focused on results. Its intent is to keep a team fully aware of the strategic initiatives, and it aligns strategic objectives with the available resources held within an organization. And then it provides an excellent framework for measuring performance from an operational perspective. Now, many organizations simply use it for measuring outcomes from an operational perspective, but the Balanced Scorecard is much more strategic than that. And that's why we think it is so critical to measuring performance in an organization. What it does is it shifts our mindset. In the private sector, where the mindset is solely focused on the financial performance of an organization or of their organization, it shifts the mindset to more intangible elements that have a greater impact on the performance outcomes of an organization. In the public sector, we tend to focus all of our energy on programs and services, and we forget that there are other elements that we need to keep balanced in order to provide those services and programs to our constituents. So we have to remember that we have to focus on all of the elements that have a great impact on the success and the true organizational performance of our organization. So what are those elements? Intangible elements mean that we're focusing on employee satisfaction, on client or partnership relationships. And for you in the public health sector, it would be our constituents or our service consumers, if you will. The knowledge or the innovation that our team holds or can offer to developing effective programs. How do we measure that? And then the operational capabilities, how efficient we use our resources and deliver those programs. And those tangible elements are those elements such as funding, inventory, operational costs. Those are the things that, have a hard number associated with them. But the others are when I get challenged by our public sector that things cannot be measured, but they can truly be measured under a Balanced Scorecard principle. So how does the Balanced Scorecard tie to accreditation? A few months ago, the Public Health Accreditation Board defined their standards and measures document to help the public health departments achieve performance excellence. So if we notice, and if you've looked up those the standards and measures, you've seen that the top three elements, the intent of the standards and measures, were to review and revise health department processes, procedures, and programs. It serves as a source for developing capacity and performance excellence and providing the core functions of the public health department. And then a guide, it's to serve as a guide for internal development of quality. The first three elements deal with elevating quality, building quality, and improving our performance, all of which the Balanced Scorecard helps us achieve within an organization. So how does the Balanced Scorecard work? It challenges an organization to look at their organization from four perspectives, and to develop metrics to collect data and to analyze relative to those perspectives being in private business, the customer or market, process excellence, people perspective, which includes the innovation, learning, building a culture, and the financial perspective. Translating that to a public sector is the constituents or programs. So how do we look at our market, that geographical area that we serve, by constituents and by the programs that we offer those constituents. The process excellence, the people excellence within our team, within our partnerships, and our funding partnerships and so forth, and then our financial sustainability and governance. And so that's how we translate those perspectives so that it works in the public health sector or in the public sector altogether. So let's look at those perspectives. The customer perspective, which is our constituent or program perspective. All of the goals relate to having to do with the programs or the services that we develop in order to service the needs of our community or our area based on your results of your community health assessment. So you've conducted the community health assessment, you've identified what the strategic issues are, and now you have to respond to those issues with programs or services. So all of the goals written under the constituent or program perspective have to do with customer service, with the services or the programs, the markets that you serve, how to deliver value to those constituents, and the customer satisfaction that you experience within the market that you serve. So all goals pertain to that. The next one is the process excellence. And with regards to the process excellence, that's building quality throughout your organization in all of the processes that you're charged to develop. So how well is your organization performing? Are the services that are being offered, do they meet the expectations or the needs identified in your community assessment? Have you looked at the processes, and are they satisfying the constituents or the shareholders? And what do you have to build into your processes or systems in order to excel in the future with regards to your services and programs? So all of the goals written in this perspective have to do with building quality and delivering value in the processes that you build into the programs. And then ultimately the people. We can't do anything in any organization, private or public, that isn't built on our team, from our team. And so our foundational element is the people excellence component or perspective. This is looking at the core competencies and the skills that we must have within our organization in order to develop or build those processes into the services or the programs that we offer our constituents. And this is how it all starts falling together. So what do we need to do to improve or continue value? Where are the areas where we need to develop core or strengthen our core competencies? How do we continue improving so that we can continue delivering the value or the services that we need to offer? And so what do we need to be doing in order for all this to happen from the perspective of our team? And how do we build that volunteer network? How do we build that partnership, those partnerships, and what do we need to look at as far as core competencies within those partnerships to continue offering our services? So that's the people component. And ultimately in the public sector, how do we get all of this finance? So we're looking at funding. We're looking at funding data. We're looking, and in the public sector, we also include governance in this area. So those policies that we have to build in so that we can provide the framework for our organization. But this perspective has everything to do with acquiring the funding that we need in order to provide the services, and as well as building in the policies that we need to develop that framework of governance that we need. So how does this tie up to those domains that were introduced by the accrediting board in their standards and measures document? There were 12 domains that were introduced, and each domain applies to a different element of your organization. So I've selected 4 of the domains, and you can see across the grid, you see the 4 perspectives: financial sustainability and governance, constituency and programs, operational excellence, and people excellence. So I've selected domain 1, 5, 8, and 9. And I'm going to show you how those are distributed amongst the perspectives of the Balanced Scorecard. So all the goals in Domain 1 have to do with conducting and disseminating assessments focused on population health status and public health issues facing the community. So all of the goals written, for the most part, having to do with domain, fall into the constituency and programs. So we're assessing our market, we're looking to see what the strategic issues are, and then we're having to respond to those issues with programs and services in order to address the needs of the community. In Domain 5, we develop public health policies and plans. So that has everything to do with building that governance framework. So all of the goals having to do with building the policies is going to fall into our financial sustainability and governance area perspective, if you will. Domain 8 is to maintain a competent public health workforce. That has everything to do with building the team that we need. And so that falls into the people excellence perspective. So all of the goals that you're going to write having to do with building that team, building the culture, building a volunteer squad, building those partnerships with regards to their skills and competencies goes into the people excellence. And then Domain 9 is to evaluate the continuous improvement of the health department processes, programs, and interventions. That has everything to do with building quality, making sure that all our processes have quality built into them, that we've looked at every I, dotted every I, crossed every T, and that excellence and quality is built into that. That falls into the operational excellence. So how do these get measured out? We have to remember that all of our goals written in any of the perspectives having to do with any of the domains have to be written in the SMART format. They have to be specific. They have to be measurable. We have to be able to attain them. There has to be an assigned responsible party, and there has to be a time-bound issue. So there has to be a time frame. So we looked at this example. The strategy components to achieve success was to improve advocacy planning. And how are we going to measure that? How is that going to be measured? We have to understand how we're going to track, how we understand how we're progressing against that goal. And so in this case, the plan acceptance rate by members is a way that we're going to measure it, or the time spent with policymakers is another way that we're going to measure our progress on it. And the level of performance needed is 85% as far as our plan acceptance rate by members, and our target is 20% of our time is to be spent with our policymakers. And so then we have to look at the initiatives. Then when we've written those goals, they're going to be tied to develop an advocacy database, and we're going to develop new and innovative programs. And to be a little more specific, I kind of went a little general in that, but to be very specific about what type of innovative programs we're going to build in. So remembering that our Balanced Scorecard defines the 4 principles. We take our domains and we basically assign them to a perspective that we feel that that's going to fall into. And then we're going to make sure that we've written our goals, all of the goals that fall within the perspectives in a SMART format, so they have specificity and they have a way that we're going to track our progress on them, and that they have a very distinctive goal or target, and that they're time-bound, that they have a very definitive time frame within which we're going to accomplish our goals. So in summary today, We want to look at a performance management tool that will give us a way to measure our performance in both our performance improvement plan as well as our strategic plan that we're developing for our Public Health Department, that we have a way to track the performance, and we suggest or recommend a balanced scorecard methodology, that we learn that our domains assigned by the FAB Accrediting Board can be aligned to the Balanced Scorecard principles. And don't forget that all your goals written should be in a SMART format. If you have any questions, I suggest that you look on our online tools at www.mystrategicplan.com. If you have any questions, please feel free to call us at our number. There's always an associate that can help you with any of your problems in developing your performance improvement plan as well as your strategic plan. And our office hours are Pacific Standard Time, 9 a.m. through 5 p.m. Thank you very much for joining me today.